Hi, I'm Dr. Stringham, and I'd like to talk to you a little bit about the FAST team. The FAST team is a recent addition to our armamentarium here in Humboldt County for things that we're able to do in order to stop this virus. So prior to last week, the state of Nevada had been doing all of the contact tracing. And so the state of Nevada, through the epidemiologist's office, they were the primary folks who were taking care of all the contact tracing and making sure that the people who were exposed to the virus or people who actually had the virus were contacted by the state. At this point, Humboldt County has taken that over ourselves, and the reason is because we think we can do this faster, and we also know the various people who are involved, and in certain situations where there are specialty situations, certain types of personalities or various other work-related situations, we know those situations better, and so as a result, we're doing this ourselves. One of the primary advantages to doing this ourselves is that we can make things happen more quickly, and we also have a better ability to know the circumstances in our community. So right now what's happening is if a person tests positive, the FAST team immediately calls that person and determines a list of possible contacts. So we figure out who that person's been in contact with, and we determine who needs to be put into respiratory isolation. Respiratory isolation is done for all people who go in for testing, and respiratory isolation starts immediately when a person is tested. And then what happens after that is people who are potentially in contact with those folks will themselves be put into respiratory isolation. We have a matrix, kind of an algorithm that we use to determine who needs to be isolated, and then the FAST team additionally will make contact with those folks each day to make sure that they're complying with their respiratory isolation. And this goes for all people in respiratory isolation. Initially, we were having some problems with people staying in isolation, and everybody was interpreting what isolation meant a little bit differently. And so now we're all on the same page, and the team contacts people to make sure that they're doing the right things. One of the other advantages to the FAST team is that because we're collecting our own data at this point, we have access to things we haven't had access to previously, the places where those infections occur. And this is also going to be much more important in the future when we start opening businesses. And the reason is because the assumption has been that the contacts, the transmissions of this virus have been occurring in the public sector, in businesses, in restaurants, and various other places. But what the FAST team is learning, and what we've been learning over the last 5 weeks, is that many of the cases are actually happening in private residences. And so we think that once we show this with the FAST team, we'll be in a much better position to be able to open businesses and make a good argument to do that safely.